Chapter 6, CPR and AED. It is important to know the difference between a heart attack and cardiac arrest. A heart attack is when the heart muscle tissue dies because its blood supply is severely reduced or stopped. This often occurs because of a clot in one or more coronary arteries. A cardiac arrest is when a person's heart stops beating. A sudden cardiac arrest is the leading cause of death. When performing CPR, we use the acronym RAB-CAB to remind us of the order in which to do things. First, R, check for responsiveness. Second, A, activate EMS by calling 911, and if there are others on scene, send one to find an AED. 3, B, check for breathing by placing 2 fingers on the carotid artery closest to you to find a pulse, while looking down across the person's chest to see if it's rising and falling. C, compressions. Begin chest compressions. A, open the airways by performing a head tilt chin lift. Lastly, administer 2 short breaths. B, give breaths. Up next is watching a video on how to do adult and child CPR step by step.
Skill: Adult and Child CPR. If the heart stops beating, blood will stop flowing in the body. If blood stops flowing, oxygen cannot be delivered to the body's cells and organs. When the heart stops pumping blood, the person is said to be in cardiac arrest and is considered dead. Cardiopulmonary resuscitation, or as it is most commonly referred to, CPR, consists of chest compressions combined with breaths to place oxygen in the person's blood. This part of the video shows and explains the complete CPR sequence. Use the mnemonic RAB-CAB to remember what to do when providing CPR. R stands for responsive. Tap the person on the shoulder and shout, "Are you okay?" A stands for activate EMS. For an adult, call 911 or the emergency response number and get an AED, or have someone else call and get an AED if available. If you are alone and the person needing help is a child, give 5 sets of CPR before calling 911. B stands for breathing. Position the person face up on a firm, flat surface. Check for no breathing or gasping breaths. C stands for compressions. Using 2 hands, interlock fingers on the center of the person's chest. For a child, use 1 or 2 hands. Keep arms straight, shoulders directly over your hands. Push hard, at least 2 inches or 5 centimeters for an adult, and about 2 inches for a child, straight down. Then allow the chest to come back up to its normal position. Do not lean on the chest. Give 30 chest compressions. Push fast, that is 100 to 120 beats per minute. Consider pushing to the beat of the Bee Gees song, Stayin' Alive. A stands for airway open. Open the airway using the head tilt chin lift method. B stands for breaths. Pinch the nose shut and cover the person's mouth with your mouth, making an airtight seal. If available, use a pocket mask with a one-way valve or a face shield. Give 2 breaths, each lasting 1 second, to make the chest rise. Take a normal breath for yourself between each breath. When an AED becomes available, use it as soon as possible.
Let's go in further detail about the acronym RAB-CAB. R, responsive. Give a firm tap to the shoulder and shout, "Are you okay?" With no response, Move to activate EMS. Shout for help. Call 911 or the local emergency number. Get an AED. If you are the one assessing the situation and will be performing CPR, provide direct instruction to someone to do the other items for you, such as you in the plaid shirt, call 911. You in the blue shirt, go try and find an AED, and if you find one, bring it back. The first B is for breathing. At this point, we're going to put 2 fingers on the carotid artery to check for a pulse. Upon feeling no pulse, after checking for 5 to 10 seconds, we're going to place our cheek directly above the mouth to feel for breaths while looking down across the chest to see if the chest is rising and falling. This observation should take no more than 10 seconds. C for compressions. Place the heel of one hand on the center of the person's chest and on the lower half of his or her breastbone. Then place your other hand on top of the first one with fingers interlocked. Push hard, fast, and smoothly with the heel of your palm. These compressions will be done in a group of 30, followed by 2 breaths. Upon completing the 30 compressions, you will move into A for airways. Open the airway. Place your hand on the person's forehead. Apply pressure to tilt the head back. Place 2 fingers of your other hand under the bony part of the person's jaw and lift. Tilt the head backwards. Lastly, the second B for breaths. Give 2 breaths that should last no longer than 1 second each. If you see the chest rise, give 30 chest compressions. If the first breath does not make the chest rise, retilt the head and give a second breath. Each time before giving a breath, open the mouth and look for an object. If seen, remove it. Finally, just remember to continue cycles of 30 chest compressions and 2 breaths until an AED arrives and you are able to use it, or EMS comes and relieves you of your job. If an AED arrives on scene, immediately begin to use it and continue with your compressions and breaths until EMS arrives. If while performing CPR, your person becomes responsive, you would then roll them into what is called the recovery position. Check the scene for safety, and now I'm going to confirm. Hello, can you hear me? Not answering. Checking for a pulse on carotid artery. Not feeling one. Checking for breath and watching the chest to see if it rises or falls. I don't see it, so going into my compressions. 2, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16, and then I'm going to do a head lift, chin tilt, pinch the nose, and administer 2 breaths. And then repeat the process. Then I could just say, and you'll repeat this cycle. Check the scene for safety. It is safe to assist this person. First, we're going to check to see if they're responsive. So we're going to do a firm tap to the shoulder. Child, can you hear me? Child doesn't respond. I'm going to check for a pulse on their carotid artery. I don't feel a pulse. I'm going to lean over and check for breathing to see if their chest is rising and falling. It is not. So I'm going to go, hey, you in the plaid shirt, go find an AED and bring it back. And you in the blue shirt, go call 911 and get EMS on the way to help. And then I'm going to go straight into my compressions with one hand.
11, 12, 13, 16, 17, 18, 19, 20, 21, 22, 23, 24, 25, 26, 27, 28, 29, 30. Then I'm going to do a head lift, chin tilt, pinch the nose, and administer 2 breaths. And then back to 30 compressions until EMS arrives or an AED arrives on scene.
Optional skill: placing a person in the recovery position. If a person is unresponsive and breathing and no spinal injury is suspected, place him or her in a side-lying recovery position. Kneel next to the person's side, straighten both legs. Place the arm nearest you out from the body with the elbow bent and the palm facing up. Bring the other arm across the person's chest and place the back of the hand against the cheek nearest you. Grab and raise the far knee until it is bent, keeping the foot flat on the ground or floor. Grab the person's bent knee and shoulder and, in a smooth motion, roll the person toward you onto his or her side, being careful not to twist the body. Adjust the person's top leg so that both the knee and hip are bent at right angles. The bent leg and the elbow touching the ground or floor serve as props. Keep the top hand under the person's cheek to cushion it. Keep the airway open and allow fluids to drain.
Let's take a moment and do a scenario. While walking your dog, you pass a house where an older man who is mowing his lawn has just collapsed. His panicked wife has not yet called 911 for help. The man is unresponsive and not breathing. Take a few minutes to discuss among yourselves what steps you would take. Hit pause. When done, unpause to move forward. Next, we're going to talk about infant CPR. First, let's watch a video that breaks infant CPR down step by step.
Skill: Infant CPR. Use the RAB-CAB mnemonic to remember the CPR sequence. R stands for responsive. Tap the infant's foot and shout, "Are you okay?" A stands for activate. Activate EMS by asking someone to call 911. Shout for nearby help. If you are alone, do not call 911 until after giving 5 sets of CPR. B stands for breathing. Position the infant face up on a flat, firm surface. If possible, use an elevated surface such as a table or cabinet top. Take 5 seconds, but no more than 10, to check for no breathing or only gasping. C stands for compressions. Place the pads of 2 fingers on the breastbone, with one touching and both below the nipple line. Give 30 chest compressions. Push hard at least 1.5 inches or 4 centimeters straight down. Push fast. Use the beat of the Bee Gees song, "Stayin' Alive." At the end of each compression, let the chest come back up to its normal position. A stands for airway open. Open the airway using the head tilt chin lift method. B stands for breaths. Cover the infant's mouth and nose with your mouth, making an airtight seal. Give 2 breaths, each lasting 1 second to make the chest rise. Take a breath between giving the 2 breaths. After 5 cycles of 30 chest compressions and 2 breaths, leave to call 911, if it has not already been done by someone else. Continue giving cycles of 30 compressions and 2 breaths until the infant breathes or trained help takes over.
With infant CPR, you can use the RAB-CAB acronym. R for responsiveness. Tap the infant's foot and shout his or her name. Make sure to shout for nearby help as well. Then activate EMS. If you're alone, Wait to call 911 until after giving 5 sets of CPR. That's 30 compressions and 2 breaths as one cycle. If you have a partner, have them activate EMS while you start CPR. Next, we're going to check for a pulse on the brachial artery. Upon feeling no pulse, we're going to lean our cheek over the mouth to feel if there's any breathing while looking down across their chest to see if the chest is rising and falling. Upon determining that this infant is unresponsive, we're going to move into compressions. Then you will move into compressions. With compressions for infants, there are 2 ways to administer them. First is with both fingers right below the breastbone. Second is with the middle finger and ring finger placed right below the breastbone. So you'll place the pads of 2 fingers on the breastbone with one touching and both below the nipple line. Then administer your 30 compressions. If this infant has 2 rescuers performing CPR, then you can switch into 15 compressions to 2 breaths. Upon completing your 30 compressions, you'll move to A, airways, where we are opening up the airways to administer oxygen. So use the head tilt, chin lift maneuver to open the airways, and then move into breaths. Cover the infant's mouth and nose with your mouth and make an airtight seal. Administer 2 puffs of air, lasting no more than 1 second each. Then continue CPR until one of the following things occur. The infant begins breathing, EMS arrives and takes over, or you become physically exhausted and unable to continue. Now let's do a scenario for infant CPR. You accompany your child to the birthday party of one of their friends. You are talking with some of the other parents at the party while the children play in the backyard pool. Suddenly, one of the older children shouts that Jack, an infant, is in the shallow end of the pool. His mother quickly pulls him to the side of the pool and finds he's not breathing. Take a moment to discuss this situation and what steps you would do. Hit pause while you discuss, and when you are ready to move on, unpause. We're going to do infant CPR, so first we need to check for responsiveness with a tap on the foot. Baby, can you hear me? Baby doesn't respond, so then I'm going to check for a pulse on the brachial artery, which is right here. For no more than 10 seconds, I don't feel pulse, then I'm going to check for breathing by leaning my cheek over their face while looking down their chest to see if it's rising and falling. It's not, so then I'm going to activate EMS. Hey, you in the plaid shirt, go call 911. You in the blue shirt, go find an AED. If you can, bring one back to us so we can use it. And then we're going to start into our compressions. With one rescuer, you're going to do 30 compressions. 1, 2, 3, 4, 5, 6, 7, 8, 10, 11, 12, 15, 16, 17, 18, 19, 20, 23, 24, 25, 26, 27, 28, 29, 30. Do a head lift, chin tilt, 2 puffs of air, and then repeat 30 compressions, 2 breaths. If you have 2 rescuers, you can go 15 compressions, 2 breaths, and you'll repeat this until EMS arrives. Now let's talk about compression-only CPR. Understanding compression-only CPR helps to increase untrained bystander involvement. Compression-only CPR is easy to teach, remember, and perform. The steps to remember are: 1. Ask another person to call 911. 2. Push the center of the chest hard and fast at the rate of 100 to 120 compressions per minute. And remember to continue chest compressions without stopping until help arrives or as long as possible. If another person is available, trade off about every 2 minutes to allow yourself time to recuperate and gain your strength to come back in and do good quality CPR. Now we're going to talk about choking. First, we're going to watch a video on how to respond to an adult or child who is responsive and choking.
Skill: responsive adult or child choking. Signs of choking are when an adult or child cannot speak, breathe, or cough and may be clutching the throat. Clutching the throat is the universal distress signal for choking. Ask the person, "Are you choking?" Shout for help to alert others of the emergency. Give abdominal thrusts. Standing behind an adult or standing or kneeling behind a child, wrap your arms around the person's waist. Locate the person's navel with a finger. Usually right-handed people will use the left hand. Make a fist with the other hand. Right-handed people will usually use the right hand. And place the thumb side just above the person's navel and below the tip of the breastbone. Grasp the fist with your other hand. Thrust the fist into the person's abdomen with a quick upward motion. Each thrust should be a separate and distinct effort to dislodge the object. Use chest thrusts on a choking, very large person or pregnant woman. Continue without interruption until the person coughs up the object, speaks, moves, or breathes, or until EMS or a trained person takes over. If the person becomes unresponsive, give 30 compressions and 2 breaths. Before each first breath, look into the mouth for an object. If an object is seen, remove it. If the person is found unresponsive, perform all the CPR steps of RAB-CAB. When giving breaths, if the first breath does not cause the chest to rise, retilt the head and give a second breath. If the second breath does not make the chest rise, begin CPR by giving 30 compressions followed by 2 breaths. Each time before giving a first breath, open the person's mouth and look for an object. If an object is seen, remove it. Continue sets of 30 chest compressions and 2 breaths until an AED becomes available.
Like with all first aid and CPR that you will encounter over the course of your life, we must always seek permission to assist. So if you notice someone giving the universal sign for choking, which is their hands around their throat, or seem to be struggling with catching their breath, you need to ask, "Are you choking? Can I help you?" and get that permission. If they say that they are choking or give you a nonverbal confirmation, wrap your arms around the person's waist and locate the navel with a finger. Then make a fist with the other hand and place the thumb side of the hand just above the navel and below the breastbone. Grasp the fist with the other hand and thrust the fist into the abdomen in an inward and upward smooth motion. If at any point your responsive choking person becomes unresponsive, then we're going to go into providing CPR with the addition of 1 step. So this is how the process would go. Give 30 chest compressions, then 2 breaths. If the first breath does not cause the chest to rise, retilt the head and attempt the second breath. Then continue sets of 30 chest compressions and 2 breaths until EMS arrives or you become unable to assist. Next, we're going to talk about infant choking care. But first, let's watch a video that breaks down the steps.
Skill. Infant choking care. Suspect an infant is choking if the infant's eyes are open, but he or she is not breathing or is unable to cry or make a sound. Shout for help to alert others of the emergency. With one hand, firmly hold the infant's jaw between your fingers. Lay the infant face down over your forearm with the head lower than his or her chest. Brace your forearm and the infant against your thigh. Give up to 5 separate and distinct backslaps or blows between the infant's shoulder blades with the heel of your other hand. While supporting the head, turn the infant onto his or her back. To do this, sandwich the infant between your hands and arms and turn the infant onto his or her back with the head lower than his or her chest. Give up to 5 chest thrusts with 2 fingers in the same location as giving CPR compressions. These are separate and distinct thrusts and are not like the faster CPR compressions. Continue alternating the 5 backslaps or blows and 5 chest thrusts without interruption until the infant stops responding or can breathe, cough, or cry, or until EMS or a trained person takes over. If the infant becomes unresponsive or an infant is found unresponsive, give 30 compressions and 2 breaths. Each time before giving the first breath, look into the mouth for an object. If an object is seen, remove it.
Now let's break the steps down. When providing choking assistance to an infant, give up to 5 separate and distinct back blows, going in a downward motion across the back with the child at an angle. Give up to 5 separate and distinct chest thrusts, which are like the compressions that we do for CPR. Remember to repeat this process until the infant stops responding or can breathe, cough, or cry, or EMS or a person who is trained takes over. Now let's talk about AEDs, also called automated external defibrillators. An AED is an electronic device that analyzes the heart rhythm and, if necessary, delivers an electric shock known as defibrillation to the heart of the person in cardiac arrest. Now you might be thinking, what does this shock do? Well, a normal and healthy heart has its own pacemaker that regulates the heartbeat. The shock provided stops all electrical activity of the heart so the pacemaker can take over again. How to use an AED. Using an AED is very simple and really helps you with your CPR process. The first thing you must do is turn on the AED. Next, attach the pads to the person's bare, dry chest as shown on the pads. Next, stay clear of the person. Make sure no one is touching the person and say "clear," allowing the AED to analyze the rhythm and follow the prompts the AED provides you. The AED will either direct you to push the shock button or will direct you to begin CPR. When prompted to begin CPR, give 5 sets of CPR unless the person begins moving, begins to breathe, or wakes up. Repeat steps 3 and 4 until the person moves, begins to breathe, or wakes up. If they do begin to move, breathe, or wake up, do not allow them to get up. Have them stay down and roll them into recovery position and keep them in recovery position until EMS arrives.
Skill. Using an AED.
Different types of AEDs are available, but all are similar to operate and have some common features. such as illustrations on the pads showing where to apply them and audio voice prompts to guide using an AED.
When breathing has stopped, the heart will too. In addition to CPR, an AED can help save a life. During CPR and when an AED becomes available, use it as soon as possible. Expose the chest. If wet or sweaty, wipe it dry. Turn on the AED.
Stay calm. Follow these instructions. Make sure 911 is called now.
Attach the pads to the person's bare, dry chest.
Remove white square package from lid of AED. Tear open white package across dotted line and remove pads.
Pictures on the pads will show where to place them.
Peel one of the white pads completely from blue plastic. Firmly place the pad without the blue plastic on patient's bare chest, exactly as shown on pads. Next, peel second white pad from the blue plastic. Firmly place the second pad on the other location. Do not touch the patient. Analyzing heart rhythm. Please wait.
Stay clear of the person. Make sure no one, including you, is touching the person. Say, "Clear." Follow the prompts.
Shock advised. Do not touch the patient. Shock will be delivered in 3, 2, 1. Shock delivered. It is now safe to touch the patient. Start compressions.
Give 5 sets of CPR or follow the AED's prompts unless the person moves, begins to breathe, or wakes up. Continue using the AED and CPR until the person moves or begins to breathe or until EMS takes over.